The Muslim woman has a unique gift which can help shape a home and give young ones a befitting upbringing. Beyond the kitchen, the Muslim woman embodies some set of skills and competencies that are capable of transforming lives. Beyond nursing babies, the Muslim woman has the capability of nursing a home and a society.
The Muslim woman is suave. She is kind. She is a dreamer and a goal-getter. She has a unique gift which the society must pay heed to in order to strive and succeed.
The Muslim woman remains modest in dressing, exudes brilliance, beauty and brains, a woman adorned in grandeur and eclat.
For this reason and more, that each Thursdays at 11 a.m. on Walkiya TV, we invite Muslim women for insightful discussions. We listen to them as they share their stories to motivate and inspire our young Muslims to achieve greater feats and heights in their lives. Assalamu alaikum wa rahmatullahi wa barakatuh. Wonderful viewers. It's another Thursday morning and the time is 11 a.m. and I welcome you to another educative edition of the Muslimah Talk show. I am Mariam, Hamidan, your host. Do not forget, the Muslimah Talk show focuses on educating you, our viewer, on a healthy living with the Muslim woman in perspective. Today, as usual, we have another health person who is here to educate us on something very, very important. I will be telling you what we'll be discussing today, but before that, I'm sure you would never want to miss any bit of this. That's why you have to stay through till the end of the show. As you're watching, please do not forget to like, share, and drop your comments below. Hajia. My beautiful Hajia. You know, her name alone is something. Hajia HULYATA ALHASSAN is our guest for today, and she's going to educate us on infertility. Yes, you heard me right, infertility. A few weeks ago, we discussed about prenatal care. So today, we are taking you back to something that can hinder that pregnancy, and that is infertility. She is a midwife at Offensive Health Center. I was shocked when I realized she's a midwife. She looks very young, very pretty.
Thank you very much.
You're welcome to the Muslim.
Thank you very much.
Thank you very much for honoring our invite. Out of your busy schedule, you still managed to push us through. We are grateful for having you here. I want to know, you being a midwife and as cute as you look, I'm just imagining seeing you in a uniform. You know, have you ever had any experience of a patient or a co-worker, I mean, talking to you like a little kid because of your size?
Sometimes it happens, especially with the clients. Okay. They will see you and when you are not wearing the uniform, they wouldn't even imagine you being. But when they see you like that, they'll be like, "Oh, small madam." Then everything will flow.
Can you share with us a little experience that you've had on that?
Once I think I went for a night shift, and on the next morning, I was wearing like my mufti.
Okay.
So one client was coming for an ANC visit, and he saw me like, "Mami, pacho me do I for no maba." I was looking at this woman and I told her like, "I'm also a midwife. How can I help you?" And she was like, "Hey, madam, sorry." And I said, "Oh, it's normal because me myself, I know I'm small, and I know it's going to happen." So Sometimes it happens and it's just cool.
Oh, it happens and it's just cool. So what can you tell our viewer out there, out of your own little experience, on being tiny and people see you and they don't want to recognize you as such because they think, you look too small to be such?
It's not their fault. So you just have to take it as it is. But then you just know, you know what you are and what you can do. So you just believe in yourself. And when somebody see you like that, and you just let it go.
Wow. Viewers, we are about to start something on infertility and we are getting an inspiration here. Thank you very much, Hajia. Now to our topic for today. We've been hearing infertility. What do we mean by infertility? And how does it even occur?
Okay, infertility basically means when a couple are not able to have children or achieve pregnancy, despite staying together and having regular sexual intercourse for 12 months. So in cases when the man is staying somewhere and the woman is also at another place, the man will come once and he'll go. If pregnancy doesn't occur in this situation, it's not infertility. When they are together, they are staying together in one room, have maybe sexual intercourse, let's say 3 times a week for 1 year, and they are still not able to achieve pregnancy, and the woman or the man is not on any contraceptive device, that's when we say we have a case of infertility.
Okay. So in a case that they are apart, it's not classified?
No, it's not classified because they are not together.
Okay. And you made mention of the period, that is 12 months.
Yes, 12 months.
I was thinking if someone gets married and it's 3 or 4 months and you're not seeing any sign,
No. We say we have infertility when they have sexual intercourse and pregnancy still doesn't occur after 12 months. That is when we say we have a case of infertility.
Oh, okay. I see. I'm getting educated. Thank you. And is it something only related to women?
No, it's not. Infertility can be a cause from both the man and the woman.
Coming back to our setting, Ghanaian setting, or even directly to our local communities, you realize that when they get married after 5 months, 6 months,
pressure on the woman.
It's the woman. People even say, go and take it, go for medication. Nobody talks about the man. So it can also come from the man.
Yes.
Oh, I see.
It's 50% chance. It's either the man or the woman. It's not always that it's the woman. The man can also cause
infertility. How common is it?
Okay, we say about 2 out of 10 couples will be affected by infertility, and it can be from the man or the woman, but sometimes even with both of them.
So in a situation that a man is having 2 wives, but you realize that maybe they've gone to the hospital. Maybe the first wife has a child, but the second wife comes. She goes to the hospital. They tell her, you are fine, and the man is also fine. What could be a cause of that?
Okay. Sometimes in medical setting, we have something we call idiopathic.
Okay.
Idiopathic causes. That one, we don't know what's causing the exact situation. They will do all the tests, the necessary laboratory tests. All the tests will say, this is fine. Both of them are fine, but still pregnancy is not coming. We have some cases like that. But sometimes it can be because of maybe diseases or genetic factors. Because in some families, you see that it's common that maybe this woman will have only 1 child.
Yeah.
That's all.
Yeah.
Another one will have maybe 2. That's all. Sometimes the genetic factors also contribute to that. That's how it is in some families.
So the genes can also be,
affect.
And you made mention of idiopathic factors.
Yes.
What other thing can cause infertility?
Okay, we have sometimes malformations of the reproductive system. In some women, they have a septate uterus. That means there's some band that is dividing the woman's womb into two. So in these cases, even when there is fertilization, the fertilized egg won't get a place to stay in the womb.
Okay.
So it will come out. And sometimes some women have some hormonal problems. Yes. So the hormones estrogen and progesterone taking place for ovulation to occur, that would be a problem. So pregnancy won't occur.
Wow, very educative. Now, we would want to know the types of infertility if we have.
Okay, basically I think we have only two types. The primary infertility is when the couple, they haven't had any child at all, or pregnancy hasn't occurred before. That's primary. But then we have secondary. That means they have maybe one child and they are not able to get pregnant again. Or maybe the woman will get pregnant, she will lose the baby, and that's all. That one is secondary because it happened before and it's not occurring again. But in the cases when it hasn't occurred at all, that one is primary infertility.
A follow-up on that. You know, we have cases where couples get married and they've stayed for, an example, maybe 5 years. And even after the 5 years, you realize that the woman would say she gets pregnant, but she's unable to reach maybe her third trimester, and then she gets miscarriage. With such people, can they be classified as infertile since she's able to get pregnant, but she's unable to get to that conception stage?
Okay. That one, I don't think it can be classified as infertility because she's able to get pregnant.
Yeah.
But it may be that something is causing her to lose the pregnancy before it gets to maturity stage. So that one is not but the infertility.
So provided the person is able to get pregnant,
yes,
she's fertile.
Yes.
Wow. I see. Viewers, if you just joined us, you're live on the Muslimah Talk show with me, Mariam, Hamidan. And I am doing this with HULYATA ALHASSAN. She is a midwife at Offensive Health Center, and she's our educator for today. Please like, share, and drop your comments below. HULYATA, you know, in our traditional setting, do I say in our Zongo communities, usually you find out that someone gets married and she's told that, you know, make sure you don't get fat, you don't put up much weight before you get pregnant, because if you gain too much weight, you might not be able to conceive. How true is this?
Okay. Sometimes obesity, when the woman is really fat, as you are saying, can cause diabetes.
Okay.
And diabetes too affects some blood vessels. So the woman becoming pregnant, maybe she'll get ovulation, fertilization will take place, all right. But for the fertilized ovum to implant, that will be a problem. So in that case, it can cause infertility. So, but it's not all the cases. So if the woman is not so fat that it can, like, too obese, no, that one shouldn't be.
Okay, so I would want to know, is there any myth surrounding infertility?
Witchcraft.
Witchcraft.
If the woman is not able to have children, she has eaten her children, like all sort of.
That is very sad. That is very
and it's always on the women. So I don't know. It's always on the women.
You know, I saw this on someone's stats. She mentioned a couple of things, and she mentioned infertility and poverty and something else, and she was like, if you have this and someone does not have, do not make fun of the person with it, because it's something that only God can decide. You know, there are cases that there are women born infertile. You know, even the Quran tells us. ya habuli manye shawo ina sawa ya habuli manye shawo zuko au yuzo wijo mzukana wa ina sawa ya almanye shawo akima. He gives some people male children, others females, and others he makes them, and with others he doesn't give any. So you are not the one who gives that. So I don't think it's even right in the first place to pass comments that affect the person, not to even think of calling the person names like witchcraft because she has eaten her
Really
children.
serious.
That's really, really unfortunate, you know. So I would want you to share with us how, when you go to the hospital, and how is a person diagnosed of infertility?
Okay. In the first place, the person will have to go through some labs.
Okay.
And it's always advisable that the person comes with his or her husband.
Okay.
Because men with low sperm counts, that one also causes infertility. So both of them have to take their laboratory test so that the doctor will decide which one is the problem coming from. And most cases, as I said, we have some idiopathic causes. Like, they will do all the labs and still wouldn't find any problem. So that is when the doctor will advise them to go in for like some artificial fertilization, like the artificial insemination, the IVF, something like that, to help them be able to achieve.
So, is it direct that if the only alternative left is the artificial insemination as you are single? Is it how do I even say? Is it assured that when that is done, the woman will be able to continue?
Okay, some people mostly is able to achieve. They are able to achieve the pregnancy, but not always.
Okay. So it's a higher number.
Yes, that's a higher chance.
That is another importance of technology. We would commend technology for helping other women to also conceive. So, do we have any sign or symptom that a woman is?
I think the only sign and symptom the person not being able to get pregnant, that's the only symptom. Yes. Apart from that, I don't think the person working, you can look at the person and say that this person is. Yes. The only thing is the person not being able to get pregnant after years of marriage or trying to get pregnant. That's the only thing that can tell that this woman has an infertility problem.
What of the males? Is there any sign that show in males?
No, it's the same thing. They are not able to get pregnant. That's the only thing that can tell that they have a problem with fertility. Because aside that, you can't just look at the person and know. There's no way of knowing except the fact that they are not able to get pregnant.
Okay, I came across this, that if a man is urinating and the urine splits into two, so he's not going to be able to impregnate the woman. What would you say on this?
Oh, okay. That one can be due to diseases like sexual STIs. And these STIs can cause infertility because they can affect the male, the passage of the semen through the reproductive organ.
Okay.
If it's not the correct normal way, it can cause infertility.
I see. So it's disease that can cause that problem, right?
Yes.
Okay. So in cases where we have a person getting old, so a woman is, let's say, 45 years or 50 years. No, let me say 45 years, let me keep it there. Is age a factor, a determining factor of fertility or infertility?
Mostly in women,
Okay.
because in women, as we age, our level of hormones production goes down, and these hormones are the ones that will like allow ovulation, like the release of the eggs. So if production of these hormones goes down as we age, that means the woman is not going to ovulate, or she's going to have problems with ovulation. And if there is a primary factor, problems with ovulation, because if there is no ovum, there can't be pregnancy.
Obviously.
So as the person ages, ovulation problems starts arising. Hormones goes down. Ovulation does not occur. Pregnancy won't occur. But with men, I know some men who are like 60 and they can still
have children.
The men, they don't usually have problems with age and fertility. I think that one mostly affects the women more than men.
So if a young woman is watching out there, what advice would you give her with regards to the range that she should give birth if she's thinking of having children?
My advice from her early middle 20s to her late 30s.
Early
middle 20s to her late 30s. Because after 40, we have few women that are able to get pregnant after 40. So maybe 39 up to, like from 20 up to 39. Our advise the woman to be like this age range, yes, because after 40 it becomes a bit difficult.
And it bounds to the ovulation problems.
Yes, the hormones problems, which causes ovulation problems, and it can cause problems in the pregnancy.
Okay. So with the men, do they have any, like, can age affect some men?
Some men?
Yes.
Okay. What I would say is, maybe as the man ages,
yes,
he will have problems with, I think, erectile dysfunction or something like that. That one can cause infertility. But if a man is 60 years but he's still active, everything is normal, the person can get pregnant. The person can impregnate, yes, somebody. So the age affects the woman more than the man.
So you talked about artificial insemination. I would want us to shift a little bit to that direction. So in a situation where the artificial insemination fails in some other people, I learned that there is a new way that a woman can get pregnant using a surrogate mother.
Yes, that's in vitro.
That's the
in vitro
idea. How is that possible? How do they do it? How is it done? I want you to enlighten us.
Okay, from the little that I know about it, I think regarding the surrogate mother, they can take the woman's ovum, and it's usually done in the laboratory. They can take the woman's ovum from her system and fertilize the ovum with her husband's sperms. And if a surrogate mother is involved, they will place the fertilized ovum into the surrogate mother, so that the person, like, let's say, will be pregnant for the couple.
So, wait. In this case, it means nothing of that surrogate mother is involved.
No.
It's only her womb that is used.
They are just borrowing her womb. But everything about the child, the genes, everything is from the parents.
Amazing.
That's what technology can do.
Wow. I haven't come across. Is there any center in Ghana that does that?
No, in Ghana. No, I haven't heard in Ghana.
Wow.
I haven't.
That's very incredible, I must say. Yes, so that is a way that other women can conceive it. But I'm sure it's going to be expensive.
Yes, I heard it's like the 10,000 is expensive. It's expensive. Because the way it is, like, I think like high technology is involved. And even if the couple doesn't want to involve the surrogate mother, they can still fertilize the ovum and the woman will carry it on her own.
Her own?
Yes, that one is also possible.
Oh, okay.
They will fertilize it in the laboratory outside.
Okay.
And after that, they will put it in the woman's womb. Yes, she will be pregnant with, yes, her own baby and everything will be.
That's interesting. Is it curable, infertility?
Okay, like it depends on the cause. I would say that in cases where sexually transmitted diseases are causing the infertility, I think with the correct antibiotics, it can be cured. But in cases when, let's say, the genetic factors or the idiopathic factors, I don't think it can be.
They are mostly difficult.
Yes. So it depends mostly on the cause, what is causing the infertility. That will determine whether it can be cured or not.
So aside the STIs, do we have any, you also made mention of diabetes, right?
Yes.
In women.
Yes, and
Aside
in men too.
In men too.
Yes.
So aside that, do we have any underlying medical condition that can cause infertility?
Okay. I think I heard some condition that affects men. They said monks or something like that. But I haven't done my own research into that one. Yes.
Okay.
But I heard it mostly causes infertility in men.
In men.
Yes.
So with the treatment, how can it be? Like, how can you manage it in case you don't want to get there? What advice would you give to our viewers out there? I don't want to get to that infertility stage. Let's assume it's STIs causing it. What advice would you want to give us?
Okay, I would advise that if the person gets symptoms of STI, the person should quickly seek treatment for it, because if it stays for a really long time, that's when it starts causing problems. So you get symptoms like you see any abnormal changes in your reproductive system, that one is emergency. You just have to go to the hospital fast and get treatment for it, because if it stays long, wahala will start.
So you treat it as early
as possible.
And is it true that candidiasis can cause infertility?
No, candidiasis. Okay, when it stays for a really long time, it can travel up. Candidiasis mostly affects the lower reproductive system of the woman. That's the vaginal area. Yes. But if it stays for a really long time, the microorganisms can travel up the reproductive system. And that one, it will cause some disease we call pelvic inflammatory disease. When it occurs like that, that one, it can cause infertility.
Amazing. Viewers, we still have with us in the studio HULYATA ALHASSAN, who is a midwife at Offenso Health Center. She has been educating us on infertility. So far, we've learned a lot. We've learned a whole lot. Personally, I have learned, and I'm sure you have also learned. She has educated us on the courses, on symptoms, and a whole lot. Please, if you just joined us, you can go back and rewatch what you have missed. I'm sure you're going to get educated and you're going to really enjoy that. HULYATA, what would you want to, what advice would you give us with regards to our eating habits? Can our eating habits and lifestyle affect us from becoming fertile in any way?
Okay. The connection I will make is regarding the diabetes problem.
Okay.
We have to eat healthy, not too much junk food, not too much sugary food. You have to eat more fruits and vegetables, such that it will prevent diabetes from occurring. And if the woman is trying to get pregnant, she eats more food that are rich in iron, so that it will facilitate blood flow throughout her body, increase her blood volume, everything, such that when everything is normal within the person's system, it can really help the person. Facilitate the hormonal system, everything, so that pregnancy can be achieved.
Your last bit before we end today's show.
Okay, I would say that any woman who is suffering from these problems should know that even if, no matter how long she has tried, there are still options out there. And I know when it occurs like this, the pressure is always on the woman, mostly on the woman. So I would advise she should just keep trying her best. Go to the hospital, follow the doctor's advice, everything. And I know, inshallah, everything will be okay.
Inshallah, everything will be okay. Yes, and my little thing, take on this will be, you know, we had Haja Aisha, the national best midwife. She was here on our show, and she was the one who educated us on pregnancy, and she told us that we plan pregnancy ahead. So it's not when you get pregnant that you start going to hospital, as you are even thinking of. And she gave us one last advice, and I would want our listeners to also take note of it. She said, if you are a woman and you would want to get pregnant, to prepare the womb, it's advisable you taking folic acid. Yes.
Iron supplements too.
And supplements too. So our guests have also added up. Please take very good care of yourself, as it's also a way of preparing. And I'm sure when you get too worried because maybe I'm not conceiving, I learned it also psychologically it affects you and also hinders that fertility. Viewers, this is how far time can bring us, and this is where we will be ending today's show. I have been doing this with HULYATA ALHASSAN, who is a midwife at Offenso Health Center. She has educated us on infertility and how we can manage infertility, how we can prevent it before it even comes into our system. I have been your host, Mariam Hamidan, always happy to be with you on the Muslimah Talk show to get you educated more together with my host. Thank you very much for joining us as always. Assalamu alaikum.